Hello, my name is Nate Hess, and I'm a park guide with the Lewis and Clark National Historic Trail. I'm working from home today. I'm sitting here at my kitchen table. I have a picture up here to the one side of me, and I have a mug rack with a variety of different mugs on it back here behind me as well. And today, I would like to talk about a historic medical practice that would most certainly not cure the coronavirus, and that is the practice of bleeding. Historical doctors are just like doctors today. Both use the most modern techniques and equipment available to them, and both want nothing more than to heal their patient. While historical medicine was sometimes misguided due to scientific and technological constraints, they did remarkably well, using common sense and good clinical practice. One of the more misguided ways historic doctors tried to help patients was through the practice of bleeding. The doctors that performed bleeding did it due to the most up-to-date science and innovation taught at the best medical schools in the world at the time, the same as why doctors do certain procedures today. The philosophy behind this is even in the Hippocratic Oath, which states, "I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow." Now, what is bleeding? Bleeding is simply the practice of removing blood from one's body to try to balance the liquids or humors in one's body. Doctors thought that if you were sick, that your humors were out of balance, and that by bleeding you, that they could bring those humors back into balance. And why did these doctors perform bleeding? Because quite simply, most of the people that they performed bleeding on did recover from their illness. Furthermore, those doctors noticed that when they bled their patient, that patient was very, very relaxed afterwards, and they thought that that was a good thing and promoted the patient getting better too. So they noticed that through their powers of scientific observation. Now, bleeding was taught at some of the best medical schools at the time of the Lewis and Clark expedition. Those schools would have been in Europe, places like Scotland, England, and France. Benjamin Rush, a doctor that helped Lewis prepare for the Lewis and Clark expedition, did train there. He went to school in Edinburgh, in Scotland. And most of the medical doctors that went away to school and were very learned at the time were proponents of bleeding because that's what they were taught in those schools. Now, hometown doctors, people that didn't necessarily go to a school in Europe or were just helping to nurse people back to health in their hometowns, bleeding wouldn't have been nearly as common in those cases. In fact, bleeding wouldn't have been nearly as widespread in those circles as it was in the more learned medical circles. Pretty much bleeding would have only been used if those doctors, if the doctor that you went to did go to one of those schools in Europe. Now, Benjamin Rush, I already mentioned him, was one of the foremost medical doctors in the United States at the time. He was a signer of the Declaration of Independence, and as a medical doctor, he helped train Meriwether Lewis before the Lewis and Clark expedition. There was no doctor sent on the Lewis and Clark expedition. Both Captains Lewis and Clark were expected as Army officers to be able to care for their men. And Benjamin Rush was able to give Meriwether Lewis a bit of a crash course in the best medical practices of the day. Some of those medical practices were things like rest if you aren't feeling well, but he was also a proponent of bleeding. And because of that, Meriwether Lewis brought several of these on the Lewis and Clark expedition, and this is called a lancet. It's basically a very, very small, sharp knife that would be used to bleed a patient. Now, this is a reproduction. It's got a white resiny handle and a sharp metal blade here as well. It actually breaks into two parts here. The two resiny parts go up and over the blade to try and cover it when it's not in use. And Meriwether Lewis brought several of these types of lancets on the Lewis and Clark expedition. They would have come in a case fairly like this, maybe a black resiny case with a little hook on the front, a little brass metal hook on the front. And there are 3 more lancets inside that case, all of different sizes and different shapes, depending on how exactly one wanted to bleed their patient. And these would have been utilized on the Lewis and Clark expedition. Most of the men on the Lewis and Clark expedition, when they got ill, would have been bled by either Captain Lewis or Captain Clark using these lancets. One of the more famous instances of bleeding on the Lewis and Clark expedition was with the American Indian woman Sacagawea. She got very, very ill on the expedition at one point, right before the captains tried to cross the Rocky Mountains, and got very, very ill, and bleeding was used on her. She got better in spite of the bleeding, possibly because she was rehydrated by a sulfur spring nearby, but bleeding was utilized on Sacagawea as well. Captains Meriwether Lewis and William Clark also performed medical treatment on different American Indian tribes that they came across as they went on the expedition, and bleeding was used in certain cases during that medical treatment as well. However, generally on the expedition, Captains Lewis and Clark, when they provided medical treatment to different American Indian tribes, tried to be very, very non-invasive and tried to very much follow the tenet, do no harm on the expedition. Now, doctors generally want the best for their patients and use the best scientific thought and teachings of the day to achieve the best for their patients. Though sometimes misguided, the actions taken by historic doctors and healers are not so different from modern-day doctors. Both use the best modern practices and teaching to try and save lives. Lewis and Clark did the same. Though they weren't licensed doctors, they learned from one of the best at the time and especially tried to follow the tenet on the expedition, do no harm. Thank you so much, ladies and gentlemen. I hope you've enjoyed learning about bleeding on the Lewis and Clark expedition. Have a great day. Bye-bye now.